A to Z disease, acute lymphoblastic leukemia. Leukemia is cancer of the white blood cells. The condition progresses rapidly and aggressively and requires immediate treatment. Warning signs of acute leukemia. Usually begins slowly before rapidly getting severe as the number of immature white blood cells in your blood increases. Symptoms include pale skin, tiredness, breathlessness, having repeated infections over a short space of time, unusual and frequent bleeding. When to seek medical advice. However, see your GP as soon as possible because any condition that causes these symptoms needs to be promptly investigated and treated. Causes of acute lymphoblastic leukemia. Acute lymphoblastic leukemia is caused by a DNA mutation in the stem cells causing too many white blood cells to be produced. Diagnosing acute lymphoblastic leukemia. The first step in diagnosing acute lymphoblastic leukemia is for your GP to check for physical signs of the condition, such as swollen glands, and to take a blood sample, bone marrow biopsy, cytogenetic testing, immunophenotyping, polymerase chain reaction, PCR, lymph node biopsy, CT scan, chest X-ray, lumbar puncture. Treating acute lymphoblastic leukemia. Treatment for acute lymphoblastic leukemia usually begins a few days after diagnosis as it's an aggressive condition that develops rapidly. Blood transfusion, chemotherapy, steroid therapy, imatinib, dasatinib, radiotherapy, marrow and stem cell transplants. If you or your child do not respond to chemotherapy, a possible alternative treatment option is bone marrow or stem cell transplantation. Transplantations are more successful if the donor has the same tissue type as you, so the ideal donor is usually a brother or sister. Prevention of acute lymphoblastic leukemia. Patients with acute lymphoblastic leukemia (ALL) may be able to help prevent the disease by not smoking. Thank you. See you in next disease.